Have you ever walked out of a doctor's appointment feeling like something was off? Like your doctor was hiding something from you? Or worse, like they were outright lying to your face? I'm Dr. David Wong, and I need to tell you something that's going to shock you. In my 20 years as a geriatric specialist here at Elderly Health Central, I've witnessed colleagues use 5 specific questions to deceive and manipulate senior women. What I'm about to reveal could save you from dangerous misdiagnoses, unnecessary procedures, and potentially life-threatening medical oversights. These 5 questions sound caring, even protective, but they're actually designed to keep you in the dark about your own health. The 5th question is the most disturbing of all. It's used by roughly 80% of doctors treating women over 65, and it could literally cost you your independence if you don't know how to respond. I'm breaking the medical code of silence today because too many of you are suffering in silence, accepting substandard care, and trusting doctors who don't deserve your trust. If this resonates with you already, I want you to comment "truth" below. If you've ever felt lied to or dismissed by a doctor, comment "me too." Let's build a community of empowered senior women who demand better. Now, before we dive in, please hit that subscribe button and ring the notification bell. This channel, Elderly Health Central, is dedicated to giving you the honest health information you deserve. Let's get started. Lie number 1, don't worry about those numbers, I'll handle everything. Picture this, you're sitting in your doctor's office. You've just gotten blood work back, maybe a bone density scan, or cardiac testing. You ask about the results, and your doctor waves a dismissive hand and says, "Oh, don't worry about all those complicated numbers. Everything's fine. I'll handle it all." Sound familiar? Here's what they're not telling you: this isn't kindness. This is medical paternalism at its absolute worst. And it's incredibly dangerous. When a doctor refuses to share your actual results, they're doing 4 things. First, they're keeping you dependent and uninformed. Second, they're preventing you from getting educated second opinions. Third, they're often hiding borderline results that need your immediate attention. And fourth, they're rushing you out of their office to maximize their appointment volume. Let me tell you about Ruth. Ruth came to me as a second opinion patient at age 71. For over a year, her previous doctor had been telling her that her kidney function was fine for her age and not to worry about the numbers. When I pulled her lab work, I was horrified. Her kidney function had been declining steadily for 18 months. Her creatinine levels had gone from 1.2 to 2.1. That's significant kidney damage. But her doctor kept saying, "I'll handle everything." 6 months after I first saw Ruth, she was on dialysis. 6 months. Had she known her actual numbers, had she understood what was happening, she could have made dietary changes, started protective medications, and potentially avoided dialysis altogether. Here's what you need to understand: your medical numbers are your property. Your blood pressure readings, your cholesterol levels, your bone density scores. These belong to you, not your doctor. When a doctor says they'll handle everything, what they're really saying is, "I don't want to take the time to educate you," or "I'm hoping you won't notice this concerning trend," or sometimes, "I honestly don't understand these results myself." So here's exactly what you say when this happens: "Doctor, I need to see my actual numbers and understand what they mean. Please print them out and explain each one to me. If you don't have time right now, I'd like to schedule a follow-up appointment specifically for this discussion." And if they resist? That's your red flag. A good doctor wants you to understand your health. If you're still with me and learning something valuable, comment the number 1 below. I want to know you're here with me. Lie number 2, this is probably just stress. Have you tried relaxing more? Ladies, if I had $1 for every time I've heard this dismissive phrase used on senior women, I could retire tomorrow. When serious symptoms get brushed off as stress, it's often a lazy doctor's way of avoiding real medical investigation. Here's why this is so dangerous: heart attacks present completely differently in women over 65. Instead of crushing chest pain, you might have fatigue, nausea, or back pain. Autoimmune conditions like lupus or rheumatoid arthritis often start with vague symptoms that get labeled as stress. Pain, legitimate, physical pain, is frequently minimized in older women. Studies show that women's pain reports are consistently rated as less credible than men's, and this bias gets worse with age. Let me tell you about Patricia. Patricia came to me at 68 after seeing 3 different doctors for persistent fatigue and joint pain. 3 doctors. Each one told her it was stress from retirement adjustment and suggested yoga classes. Yoga classes. For what turned out to be lupus. When I ran a comprehensive autoimmune panel, something none of her previous doctors had bothered with, we discovered she had systemic lupus erythematosus. 2 years of joint damage could have been prevented with early intervention. Here's what's really happening when doctors blame stress. First, they're under insurance pressure to avoid expensive diagnostic testing. Second, there's unconscious bias against older women's health complaints. Third, they're dealing with time pressure in appointments, and stress is a quick explanation that gets you out the door. But here's the truth: yes, stress can cause physical symptoms. But stress can also cause serious medical conditions, and stress can worsen existing conditions. Either way, it deserves real medical attention, not dismissal. So when a doctor tries to blame stress, here's your response: I understand that stress can cause symptoms, but I'd like to rule out physical causes first. What specific tests would you run if I were 40 years old with these exact same symptoms? That question will stop them in their tracks. Because they know they'd order blood work, imaging, referrals, real medicine. Age should not change the quality of medical investigation you receive. Line number 3. Let's wait and see how you feel in a few months. Wait and see. These 3 words might sound reasonable, even cautious. But for seniors, time is often the enemy of successful treatment. Here's what they don't tell you: many medical conditions progress rapidly in people over 65. Early intervention is absolutely crucial for better outcomes. When doctors suggest waiting, they're often hoping your symptoms will resolve on their own so they don't have to deal with complex diagnostics. Sometimes, and this is harsh but true, they're essentially pushing your problem down the road until you become someone else's responsibility. Let me share Helen's story. Helen came to me after 8 months of memory lapses that her previous doctor wanted to monitor. 8 months. By the time I saw her, what could have been addressed as mild cognitive impairment had progressed to early-stage dementia. The cognitive rehabilitation therapies that work best in early stages were no longer as effective. Think about this: if Helen had been 45 with memory problems, would any doctor suggest waiting and seeing? Absolutely not. They'd order brain imaging, cognitive testing, blood work for reversible causes. But at 74, suddenly, wait and see becomes acceptable medical practice. Here's what's really happening. Doctors are hoping symptoms will resolve naturally, avoiding difficult conversations about aging and potential diagnoses, and frankly, pushing complex problems to future appointments when they might not be your doctor anymore. When a doctor suggests waiting, here's your response: I'm concerned about delaying investigation. What are the specific risks of waiting versus acting now? What would early treatment look like compared to waiting until symptoms worsen? Force them to justify the delay. Make them explain why waiting is medically appropriate for your specific situation. Comment "waiting" below if a doctor has ever told you to just wait and see when you knew something was wrong. I see you, and your instincts matter. Line number 4, your insurance probably won't cover that anyway. This one makes my blood boil. When doctors play insurance gatekeeper before even checking your coverage, they're making financial decisions about your health without your consent. Here's the deception: first, they often haven't actually checked your specific coverage. Second, they use this excuse to avoid paperwork and prior authorization hassles. Third, they steer you toward cheaper, less effective treatments. And fourth, they assume you can't afford alternatives without asking. Dorothy's story illustrates this perfectly. Dorothy came to me at 69 with severe osteoporosis. Her previous doctor told her that the newest, most effective medication was definitely not covered by her insurance and prescribed an older drug with more side effects. When Dorothy called her insurance company herself, she discovered the newer medication was fully covered with just a simple prior authorization. Her doctor's assumption cost her 6 months of continued bone loss. Here's what you need to understand. Most doctors don't actually know the details of individual insurance plans. Many are financially incentivized to choose cheaper options through their clinic's contracts. Prior authorization paperwork is time-consuming, so they avoid it. And some have financial relationships with certain pharmaceutical companies. But here's the bigger issue: your doctor's job is to recommend what's medically best for you. Your job is to decide what you can afford and what your insurance covers. They're making financial decisions they're not qualified to make. Here's your response: "Doctor, I'd like you to prescribe what's medically best for my condition. I'll handle the insurance side myself. If there are coverage issues, we can discuss alternatives then." Take control of the financial conversation. Don't let anyone else make assumptions about what you can afford or what your insurance covers. And now, lie number 5, the most insidious of them all. You're doing great for someone your age. This seemingly positive comment is actually medical ageism disguised as encouragement. And it's everywhere. When doctors tell you you're doing great for your age, they're setting artificially low expectations for your health. They're dismissing legitimate health concerns as normal aging. They're preventing you from pursuing optimal health, and they're creating what psychologists call learned helplessness. Let me tell you about Margaret. Margaret came to me at 76 with chronic pain in her hips and knees. For 3 years, her previous doctor had told her, "Your pain is really normal for someone your age. You're doing great." Margaret had accepted decreased mobility. She'd stopped gardening, stopped her daily walks, stopped living fully because she believed her pain was just part of aging. When I examined Margaret and ran comprehensive blood work, I discovered severe vitamin D deficiency, completely treatable with supplements. Within 3 months, Margaret was pain-free. She's now 79 and hiking regularly. Here's what "you're doing great for your age" really means: don't expect too much from your body. Accept decline as inevitable. Stop asking for better care. Your quality of life doesn't matter as much because you're old. But age is not a disease. Yes, our bodies change over time, but many age-related problems are treatable, preventable, or manageable. A good geriatrician doesn't say, "Great for your age." They say, "Let's work on optimizing your health," or "Age is just one factor we need to consider," or "We can definitely improve this condition." When someone tries to lowball your health expectations, here's your response: "I'm not interested in being good for my age. I want to be as healthy as possible. What can we do to improve this condition, regardless of my age?" Demand age-neutral medical care. You deserve to pursue the best possible health at any age. These 5 lies. And make no mistake, they are lies, are designed to keep you passive, uninformed, and settling for medical care that's less than you deserve. But you now have the tools to fight back. 1. Always demand to see your actual test results and have them explained. 2. Question any dismissal of your symptoms as just stress. 3. Refuse to accept "wait and see" without medical justification. 4. Never let insurance assumptions guide your medical care before you check yourself. And 5. Reject any ageist limitations on your health goals. You deserve a doctor who sees you as a whole person, not just a collection of age-related problems. You deserve honesty, respect, and partnership in your healthcare decisions. Share this video with every senior woman you know. We need to stop accepting substandard care just because we're older. We need to stop letting doctors lie to us out of convenience, bias, or laziness. Comment below with the biggest lie a doctor has ever told you. Let's support each other in demanding better care. Subscribe to Elderly Health Central for more honest truth about senior health. Hit that notification bell so you never miss our videos. Your voice matters. Your health matters. And you deserve honesty from every medical professional you encounter. Next week, I'm exposing the 3 medical tests that doctors order unnecessarily for senior women just to increase their clinic's profits. You definitely won't want to miss that investigation. Until then, keep advocating for yourself. Keep demanding better. You're worth it. Thank you for watching, and I'll see you next week.